I do have serious concerns with approving new programs and new funding when we do not yet know the outcome of the latest versions of the partisan reconciliation bill, and all the while funding from the last partisan reconciliation bill remains unspent. For the last month now, the majority has been negotiating behind closed doors, trying to tie together a bill with the only requirement is that it can pass, with little regard to the long-term impacts of that chosen policy. Negotiating backwards from a top line, a price, and then trying to fill in the details, that's not a good way to legislate. And when they do release texts, it often doesn't line up with the outcomes. One such example happened just yesterday, when the text before rules appeared to state that negotiations on drug pricing may occur 10 years for biologics, in contrast, 7 years for small molecules. And the White House outline states that the drug products would be 9 years for small molecules and 12 years for biologics. Numbers matter, details matter. Notable admissions in this $1.85 trillion bill, although we have no confirmation it actually costs $1.85 trillion, is that there's no CBO score. There is not a pathway forward to avoid crippling Medicare reimbursement cuts for our frontline healthcare providers who have remained steadfast during a pandemic. The cuts to the frontline healthcare providers will potentially decimate healthcare practices, particularly in the rural and underserved areas where Medicare payments make up a larger portion of their patient population. We could be working today on a bipartisan solution to this. We all know that the deadline is coming at the end of this year, and the clock is ticking. Lives are on the line. Patients and hospitals will ultimately suffer. This committee also could be working to find ways to immediately provide relief for hospitals who are suffering from constant staffing shortages, and in some dire cases, cutting back on the services that they provide to our communities. Instead, the administration is doubling down by releasing a one-size-fits-all vaccine mandate. And while we will be playing yet another game of wait and see on a partisan bill that is very unpopular with the American people and will do nothing to stop the multiple crises that we are currently facing, my plea is simple. I urge that we work together to address these issues in the bipartisan way that is the tradition of this committee. Thank you, Madam Chair, and I yield the balance of my time.